am Dr. Tahl Humes. I am a physician that specializes in all non-surgical aesthetic treatments. I've been practicing for almost 20 years and have multiple medical spas across the country.
Hi, my name is Celeste Rodrigues. I'm a licensed esthetician of 15 years. I specialize in corrective skincare, and I have a medical spa in Beverly Hills.
Hi, my name is Candace Marino. I'm a licensed esthetician for 17 years, and I am the founder of the LA Facialist in Beverly Hills, California. I've been a licensed esthetician for 17 years, and I feel like this was totally my calling. My mom had all the lotions and potions, and I just was mesmerized by watching her in the mirror. And so as a young adult, like right out of high school, I went to esthetician school, and it has been my career ever since. I've worked in all arenas of skincare. So medical side with dermatology practices and plastic surgeons, and then on the wellness side. And so for me, I love the merge of those two worlds. I think that so many people do one really well. So the goal for me has always been to blend the two and make it a place where people can have like a corrective treatment, but also give them that touch of like a spa. So I feel really lucky that I have this career, something that has stood the test of time for me, and I've just maintained my passion for it.
I, on the other hand, didn't come from a household where my mom was constantly doing lotions and potions or really anything into the beauty industry at all. And coming to LA to do acting and modeling, it really drove me to start really paying attention to my skin. And because of that, I needed a plan B in LA just in case that wasn't my end goal. And then it became my plan A because I really got so passionate and so involved in it once I started esthetician school. And it has just been such a passion of mine ever since.
Kind of in between both of you for me. I didn't grow up with, thinking about skin. I was not the child who understood what to use on my skin at all. In fact, in my early 20s, you're going to shriek a little bit from this, but I was using ivory soap. Yes. So that's what I thought was good because who needed anything else, right? And then I went to medical school. Again, wasn't thinking about skin. I was thinking about healing everyone, working in the hospital. And I was in residency, and one of my friends said, wouldn't it be so cool if there was a place where you could go for yoga and get some Botox while you're there? I was like, that would be wonderful without the yoga. It sort of spearheaded me into thinking about this. I was like, wait, I actually really do like this. What am I going to do with it? Still, even when I started this and started my first practice and was going through it, I never realized how much I was going to love the skincare aspect. And now it's really more about healing the skin, taking care to look at the patient and understand what's going on with their skin, not just using a needle to get rid of a wrinkle.
It's funny because about 13 years into my career, I had this moment of I'm never going to make it, like financially, because I don't think people go into skincare thinking like, oh, I'm going to gain a lot of wealth. This is like a huge, money-making career. So I actually put myself through nursing school at the age of, I think I was 28. So kind of a late start to going onto the medical side. And the only thing I learned from going to nursing school, well, I learned a lot and I changed diapers and it was really messy, but I deepened my passion for skin. And I proved to myself that like, you don't have to be on the medical side to actually make a living in this industry. And so I just feel so empowered by like the fact that I dipped my toe into that world, but then it dove me deeper into what I actually know and love. And so I understand where you're at with the medical side of things. I think you're in the best place in the medical industry because you get to dip into both worlds. And it's like the best of both worlds.
I agree with you. I mean, I feel like, one, hearing your story, I love that you kind of be like, okay, I'm going to reimagine myself. And then you're like, wait, I didn't actually need to do anything. I just needed to change what I was doing a little bit, right, to make it really a true career.
Yeah.
But it's exactly like you say. I mean, I feel so lucky that I get to work with these patients and I get to take care of their skin and I get to see those changes. And I mean, not that it wouldn't have been great to work in the hospital and there's parts of it I love. There's a lot I don't miss.
Yeah.
But I would never get to do that.